Hi there, everybody. I'm JR Burgess with Katalyst Pain Management and Restorative Treatment Center. We're here to talk a little bit about some of the challenges we've seen in pain management and around the opioid crisis altogether. And you have a little bit of a history of dealing the inner works of how it can affect a family emotionally, physically, and mentally. And you've joined Katalyst because the challenge of how do we help people heal using their body's own ability to heal. Tell us a little bit about why this is so important to you.
Sure. So my name is Amanda LaPlante. I'm an integrative health coach, and I grew up with a grandfather who had chronic pain issues. And it was, from the time that I was very, very, very small, I watched him struggle with prescription after prescription and procedure after procedure. Many of them failed. And getting really on that cycle of being very addicted to these narcotic pain pills. And seeing what that does to the body, what that does to the mind, and how that strains a family. He did his best to be responsible with his medications and manage it, and we were very blessed in that regard as a family. However, I know that there are many other families who are not so blessed, and I've had the unfortunate experience of sitting with several mothers as they've sobbed and grieved the loss of a son or daughter to opioids. And so it's really something that hits my soul, hits my very soul. And there are so many other ways that we can approach pain management. What I love about Katalyst, and one of the reasons I was so excited to become part of this team, is, first off, that experience that I had growing up with someone that I loved absolutely dearly, who every painstaking step, it was so hard for him to just get through the day, and to know now, having the same genes and having fought pain issues myself and thankfully overcome, and having fought autoimmunity myself and overcome, now I know that there were so many different triggers for the inflammation. Diet is incredibly important. Stress management, incredibly important. Emotional trauma, incredibly important. All of these different factors and more that we can do something about here at Katalyst. We have these different tools that Dr. Butwell is open to bringing in and really meeting people where they are, where it's like, okay, if we need that prescription or that procedure, she can do that. She's world class and she can, but she also understands that there are so many other things that are important for these outcomes. And I'll kind of digress there and let you dive in.
Yeah, I think that's just the point. Is pain is the most expensive burden one can carry. It affects and shows up in all areas of life, from financial to relational to, doing the things that you love and having a challenge doing that. And unfortunately, the healthcare system became a volume game. And I don't think any doctors knowingly wanted to prescribe medications that could potentially hurt the patients, cause overdose, or, some of the challenges they have. But these things are highly addictive. And they don't help you heal, they help manage the pain. So if we're not looking at all those factors that you talked about, you're only potentially making things worse if we're not addressing the cause of these things. And with addiction and not learning how to get people taking comprehensive plan is why Dr. Butwell brought the likes of you and me around, meaning that healthcare in general, you can't see 40 patients a day and give them the time to look at all these avenues, to look at the food, to inspire, to listen to what's worked, not worked. And she's brought you and I on to really, after she gives a recommendation, for us to help game plan and meet patients where they're at, putting a comprehensive plan in place. And I won't call it easy. I've had numerous surgeries. I've dealt with pain my whole life, overcame Lyme's disease, multiple surgeries, and it's been the physical, mental, emotional, working with a team of providers that don't give up, that care, that know that some of these things help and make a difference. But it takes a compliant patient, it takes somebody wanting to get better, it takes all factors. But we've learned how to put systems and running integrated healthcares together for a long time that meet patients where they're at, that have world leading and compassionate providers and allied care professionals that are great at coaching and inspiring, because it's not an easy journey and there's a lot of factors. And that's why it takes a team, it takes a family, it takes everybody gaining power over pain. And thankful for you and everything that you're doing to help our patients really get dialed into having a team working with them, providing hope, having personal experience, and us never giving up. We're not going to stop the journey of making a plan work for a patient. So thank you.
I want to say that from the moment that I walked in the door, I used to go to a lot of those pain management appointments with my grandfather when I was very small. And I remember walking through the door here and thinking that everything about the energy in this place was just different than what I had ever experienced in those appointments. And going forward, I sat in and got to shadow Dr. Batwell the first few times, and my mind was just blown. I was literally brought to tears by the difference in the quality of care and the way that she looks at people and the way that she looks at their circumstance, the whole spectrum. It's just really a magical place. So I would highly suggest that anyone out there get on the phone and get in touch with Katalyst Pain Management, because my goodness, what a world of difference it is.
And
I'm so thankful.
that's the first place. Pain is a difficult place to be. If you don't have somebody that you feel's like rowing just as hard or is just as excited or that really cares to see you better, that's such a gift that we have that here at Katalyst between Dr. Batwell, Julie, Dr. Meehan, is they want to see people get better, and then we get to do what we do best: spend the time, develop, coach, find that one place we can start. And great, the more committed or bought in or getting better along the way, the faster we can row sometimes. But we're happy to meet you whatever that pace is. So thank you all.
Absolutely.